We're not the forbidden doctor. I'm not the forbidden doctor. It's in you. The forbidden doctor is that magical, mystical power inside of you that's controlling and healing everything. It is that beautiful, marvelous, almost miraculous force that controls all healing. It's that innate intelligence, that life force directed influence that triggered your DNA to build your body after conception. It's that power that sustains your life. It repairs your wounds and lesions, and it never stops working. It is that essential part of you that keeps you alive, and it heals your every hurt. This is the forbidden doctor. It's not me. It's that part of you, the powers that be, have decreed forbidden to ever learn about or even consider and never ever rely upon. For it's forbidden that you even know that this life force exists at all. You are your own forbidden doctor. Hey everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 169. A simple trick to reduce the risk of heart disease, breast cancer, and fatty liver.
Wow, it's a mouthful. We have some exciting, probably unknown to most of you, forbidden information relating to a dietary deficiency that can lead to those serious diseases.
Yeah, what we're going to talk about is a component in some foods that might be lacking in your diet due to ignorance among the dietary industries and collusion on the part of several concerns in the medical industry. Now, we're not picking on your medical doctor, believe me. Just remember, he or she was taught the chemistry of drugs. They were not taught the chemistry of foods.
And rebuilding and restoring.
And the restorative principle.
Yes.
Right.
But before we get to that, for our regular listeners, the next 4 minutes is our financial stuff, so you can fast forward through it if you choose. But for our new listeners, please listen at least one time so you understand how and why we do things around here.
Before we begin this informative and forbidden podcast, we want to take a few minutes to talk about why we do not have sponsors.
Yeah, we've been approached many times to sell different products on our show.
But we've always been compelled to resist these financially tempting offers because many times they lead to an attempt for editorial control over what we say.
Yeah, and what we're doing here is too important to be controlled by corporate interests. So we never allow this kind of advertising on our show.
And so that said, we don't make money from these podcasts. All of our income comes from your interaction with us and what we have to offer, and from the sale of our Forbidden Doctor products and supplements from the oldest and original whole food supplement manufacturer in the United States, Standard Process.
Yeah.
But we're not paid by Standard Process. Indeed, they distance themselves from open internet promotion because of constant scrutiny from the FDA.
Yeah, and as a result, they do not advertise or pay for advertising outside of a licensed healthcare professional's office.
And the reason for this is really simple, because their products are very powerful and they actually work.
Yeah.
So they need to be careful about people making claims. Others have mentioned that while the knowledge we share can't be found anywhere else, it is often tied to Standard Process.
Yeah, and that also includes our own ageless thyroid and long life energy enzymes products.
Yes, and so you might ask, could not our own products be creating a conflict of interest? Mm-hmm. I mean, have we mistakenly created infomercials instead of free knowledge podcasts?
No, we do this on purpose.
Yes, because years of experience on the radio and in our clinics and almost 500,000 downloads of our podcasts have taught us a few things. And the most important is that the type of nutrient-dense foods that most of us need to get our bodies actually healing from years of malnutrition are not easily integrated into most of our lives.
Yeah, the quest for excellence in nutrition has never been an easy task. Just face it, nobody wants to eat raw liver. But absolutely no one will sign up to eat raw liver daily for 6 months. So we feel therapeutic supplementation is sometimes very critical in the healing process.
Yes, it is. So let us be clear. We talk about Standard Process because this is how you can get whole foods in a concentrated form that you would never, ever eat on a daily basis.
Mm-hmm. And the reason we do our podcast this way is because it has saved our lives and countless others that we've worked with over the years.
Yeah, so we sell supplements.
Yeah.
And so we try to give free knowledge away about how nutrition touches every aspect of our lives. And so necessarily these two are going to overlap. But the bottom line is, we may mention supplements that you can get from our website, but the knowledge we share is real. And you can take that with you forever, whether or not you ever buy anything from us.
But you can support us in keeping this podcast on the air with a donation at forbiddendoctor.com/donate.
Yes.
Or if you're ready to take your first steps for your own health, you can join our family by going to our website and taking our free symptom survey.
Now, we understand, we really do, that some of you may feel real hardship with even a modest purchase and cannot afford even a single month's supply of supplements. So please know then, it is completely okay if you do not buy our supplements or financially support our show in any way if you cannot afford to.
Yes. However, there are many ways to support us for free. You can give us a 5-star rating on iTunes. That's easy. Or a thumbs up on YouTube. Wherever you listen to our podcast, just give us a good rating.
Yeah, and if you already support the show, thank you. Truly, thank you. And please know that you are the very reason we fight this good fight. I mean, your support makes this all possible.
So now let's get back to the forbidden information they don't want you to know.
Oh, yeah. And before we jump into our podcast, we also want to remind you about our free symptom survey, which we offer on the homepage of our website, forbiddendoctor.com.
It's the most comprehensive survey you will ever take. It has tons of questions, and after you're done, you have the opportunity to have a free 30-minute phone consultation. You don't have to do that, but you have that opportunity, and you'll be given a personalized protocol. Now, this saves you money in the long run because you're not taking supplements you don't need. How many of you have 1 million supplements at home and you don't even know what they do?
Right.
So this is all...
You forgot where you got it or why you got it.
Yeah, or why. But this is all free. There's no charge to you. Just go to our website and take our symptom survey.
And our weekly feature, Forbidden Secrets They Don't Want You to Know. These are the secret things they keep from you, the dumb things they tell you, and the really important things they know nothing about.
Okay, things they don't tell you. This just kills me. Yesterday, I burned my palate with and my tongue and everything with really hot boiling tea. Jack got me this incredible tea, and I always put, we have these Yeti glasses, and I always put a whole pile of ice cubes on top of the tea.
That's the strangest thing you've ever seen.
It's super cool because
an insulated cup of hot tea and a plastic the lid sitting on top with about a half a dozen ice cubes piled up on top of the lid.
Because they melt, and when they melt, then I know the tea's cool enough. That
I know, it's a great idea. I've just never seen it before.
It's kind of brilliant.
Yeah, well,
but
it is.
We were working yesterday, and I grabbed that Yeti cup and didn't you didn't put the stuff, the ice on top, so just subconsciously I took a big gulp, and
that's how that happened.
Yes.
I'm so sorry.
I'm blaming you.
I'm sorry.
No, but I spit it all over the living room. It was really a mess. Luckily I missed my computer, but anyway, I had a horribly burned palate. I mean, it bubbled up inside on top.
Oh.
It was really bad. So what did I start to do? I started chewing. I didn't cry.
Oh, no, I'm just guessing. I thought you asked a question.
You were there. I started chewing chlorophyll pearls. Okay,
That's right.
Immediately stopped the burning, inflammation, the pain. I had green teeth all day long, but I just kept chewing those chlorophyll pearls. Now, here, the point I'm getting at is that you can fix things inside of you. You're not stuck with this. You know, the medical society, or you'll go in and they'll say, you're allergic to this and that, and you have celiac disease, and you have IBS, or chronic fatigue is a big one, and your hormones are all messed up, and, you know, that's all it is, your hormones. You just need some progesterone, or you have a gallbladder issue, and you need to get your gallbladder taken out, or whatever it is, it's yours forever and ever. They're not geared to, your digestive tract, which the mouth, which was yesterday, is part of the digestive tract. It heals very quickly. And why? Because if your mouth...
Well, you can't go very long without eating food
No.
if there's some kind of lesion, burn, something in the mouth or the throat.
Yeah. Or inflammation in your esophagus, all these heartburn patients and people we see, and then down IBS, just massive ulcerative colitis. This stuff heals really quickly. We have so many people that have ulcers, and, the medical route is to go in and cut out the ulcer and sew it back up. It's unbelievable. Yeah. Or get on an antibiotic now because of the discovery they won a Nobel Prize for, that Dr. Roy Lee discovered, 40 years earlier, that H. pylori causes ulcers and different things like that. But they're not geared towards healing. See, that's what the forbidden information I want you to know. Because my palate, like that's why we didn't do the podcast yesterday, is I sounded funny. I was
Yes.
all burned inside my mouth. And so it's all healed today. You don't know that you can heal your gut and your colon and your small intestine and your stomach. I mean, just chew up some chlorophyll if you have ulcers. I mean, it's like miraculous. Now, granted, if you have a bad gallbladder, you also need some bile salts, but we're going to get into that today. But these things can be healed, and that's the things, excuse me, that they don't tell you. So, now, let's get on with things they don't want you to know. Okay. Could it really be a simple trick, like our title says, that can reduce the risk of heart disease, breast cancer, and fatty liver? Well, in a word, yes.
Yes, that simple trick is a simple nutrient that is often missed due to a severe level of ignorance that exists in today's medical intervention into the world of nutrition. Mm-hmm. So a recent podcast about why medical doctors do not recommend nutritional therapy explains this ignorance further. I think it's podcast 160.
Yeah, something about you've been duped and brainwashed. Yeah.
Well, what we're talking about is the supplement choline.
A B vitamin.
It's a B vitamin.
Yeah. Choline was initially discovered in 1862 and was officially recognized as an essential nutrient for human health by the Institute of Medicine in 1998.
Yeah, wow, that's only 136 years later that medicine said, here's a B vitamin that might be good for you.
So we don't know everything. But this nutrient, which you need to get from your diet, by the way, it's required for such important things.
Oh,
Let's just start the list.
Well, healthy fetal development. You always hear about folate being necessary for a developing baby's, it's not even a baby yet, a developing fetus's nervous system. Well, choline is required for the proper neural tube closure, for brain development and healthy vision. The neural tube, the first thing that it develops as an embryo is not the heart. It's the beginning of the nervous system.
So cool.
The heart doesn't start beating for a few weeks. But the nervous system, within 8 days of conception, these little cells start lining up that form the neural tube that's going to become the spinal cord.
Doesn't have fingernails, right? Like
no fingernails, no personality.
But it has
no vanity.
A nervous system, which is your playground.
Yes, the nervous system is really the first thing to develop. And we hear about folate all the time, but we don't always hear about choline.
Closing that spina bifida.
It is. It to close things down. And choline deficiency can cause lifetime memory problems, because it affects the hippocampus, the memory center of the child's brain. But choline deficiency can also raise your risk of premature birth, low birth weight, preeclampsia, and oral cleft defects in babies.
Now let's say that again. Research shows mothers who get sufficient choline while they're pregnant impart lifelong memory enhancement to their child. Lifelong memory enhancement.
Just
I
to make
bet you
sure
my mom didn't get enough choline. Trying to remember the things you remember, your mother must have.
My mother had 5 pounds of choline a day when she was pregnant with me.
So the forbidden information is that we should recommend folic acid for prevention of spinal bifida for expectant mothers, but also choline to prevent cleft palate. But we don't do that.
No.
Then, as we talked about in our last podcast, I think, iodine for Down syndrome.
Yes.
But we don't do that either.
So it also strengthens the cellular membranes, the walls. Imagine a water balloon. That's the cell membrane, and it strengthens that.
Now this is in us, not the babies, but it helps them too.
Yeah, it helps
but
them.
This is for us.
But it helps all of us.
Uh-huh.
And it's because of the forming of what are called phospholipids. It's the coming together of phosphorus and fats. Mm-hmm. One side is water soluble, the other side is fat soluble. It's the border of our skin. It's the border of organs.
The cell membrane.
And the most common form of that is something called phosphatidylcholine, which is better known as lecithin, which makes up about 40 to 50% of our cell membrane, 70 to 95% of the phospholipids in lipoproteins and in bile.
Wow.
So choline is an absolutely essential aspect of our diet.
And as we talked about, it's also essential for the nervous system of us as we're adults. Choline is necessary for making acetylcholine, a neurotransmitter that's involved in healthy muscle, heart, and memory performance.
Yes.
Now, that's interesting when you come to statins, because choline helps you emulsify fats and gets transports fats out of the liver.
Yeah, we're going to talk about that.
Yeah, so that's that's the symptoms there when you go on a statin is muscle pain. Well, I don't know about heart, but memory performance.
Yes.
So,
did you know that the cells of your body have phone numbers? Because cells talk to each other.
Yes, they do.
Cells talk to one another.
That's called a relationship.
Cells have a relationship. That's right. If you looked at a cell from
What
your
we
liver,
have here is
it might be on a match-up website with a cell from your heart, because the liver and the heart communicate with one another through cell messaging compounds, of which choline is a very important part.
These are the neurotransmitters.
Yep.
Okay. And for fat transport metabolism, as I said, choline is needed to carry cholesterol from your liver, and a choline deficiency would result in that not happening, and so you will have excess fat and cholesterol buildup in your liver, which leads to fatty liver.
And DNA synthesis simply means when a cell replicates, when it divides into a new cell, it has to make a new DNA strand. And in doing that, there are some vitamins that are necessary as folate and B12, but also choline is necessary for DNA synthesis, for DNA to be manufactured by the mother cell into the daughter cell. And also methylation reactions. Methylation is just where a methyl group, CH3, is added onto a compound to change its orientation or to make it water soluble or to assist liver detox, these kinds of things.
Well, dang, that's got to happen.
Yeah.
Got to have that.
You got to have that. And what is considered to be healthy mitochondrial function. Remember, the mitochondria are in all of your cells. Mm-hmm. Some cells have a little bit of mitochondria. Some have a lot of mitochondria. Those are the nuclear power plants of the cell.
Get you up and
And
going.
one cell can have 1,000 mitochondria inside of it. The oxygen's made there. Protein structures are triggered there. And choline helps that to take place.
Yeah, so a healthy mitochondrial function. So, studies have linked higher choline intake to a range of benefits, including the decreased risk for heart disease.
Yes.
A 24% decreased risk for breast cancer.
And the prevention of non-alcoholic fatty liver disease, which is largely driven by high sugar diets as opposed to excess alcohol consumption. Some of my patients I've talked to about this were quite surprised to find out that 1 out of 3 people who have hepatitis, who have cirrhosis of the liver, are not drinkers. They do not imbibe in alcohol at all. 1 out of 3.
Yeah, we have tons of non-alcoholic fatty liver disease.
It's like lung cancer. 1 out of 3 people with lung cancer in America never smoked a cigarette. Mm-hmm. So there's other factors. So we discussed this at length in podcast 146, fatty liver disease. Now, some animals cannot produce choline. Now, that's spelled choline, choline. They have to get it through their diet. Now, humans can make a little bit of choline in the liver, but diets that lack choline can lead to fatty liver and muscle damage. We're going to talk about that, though this effect varies, from age groups and men and women and postmenopausal or premenopausal.
Well, postmenopausal women are a lot more susceptible to the effects of lack of choline.
Yes, than premenopausal.
Mm-hmm. In fact, choline really appears to be the key controlling factor in completely preventing fatty liver.
Yes, you were mentioning this earlier. You can get into this a little further.
Yeah.
How does it do that?
Well, it transports the fat out of your liver, helps package it up, and the big thing is if you can clean out your liver, you will have tons more energy. Yeah,
the liver gets bogged down by the toxic stuff that's in our diets, things that are not in our diets, like choline. Mm-hmm. And it spends most of its time trying to clean house rather than clean the blood, which is where greater energy comes from anyway. Yeah. And the research has also discovered evidence of epigenetic mechanisms of choline. We talk about epigenetics in, what was it? Was it 103 podcast?
101, I think.
101?
Angelina Jolie.
Yeah. We talk about how outside factors control whether a gene expresses itself or not.
That's critical.
Yeah, genes don't just express themselves because they haven't got anything better to do. or had a bad hair day, there's something that triggers a gene to turn on and to turn off, and that's the epigenetic concept. And choline helps maintain healthy liver function through that epigenetic effect. And then one more thing I want to mention: deficiency. Yeah, the choline deficiency can also have a role in liver disease, atherosclerosis, and possibly some neurological disorders, according to some studies. And one sign of choline deficiency is an elevated level of the liver enzyme ALT. Now, there isn't a week that goes by that at least one patient that I've been taking care of for a while, by order of their medical doctor, had their annual physical, whatever else, and they got a blood test, and they come back to me and they say, well, the only thing that was really wrong was some of my liver enzymes. And I said, well, I suspect they were elevated. And they say yes, and I said ALT and AST. And they said, yeah, that's exactly right. What do you know?
Well,
guess
what that can lead to? But go ahead.
Well, I never, in all honesty, I never talked to him about choline deficiency.
Come over there and slap you.
Yeah, I always talk to him about, in the sense of, hey, it probably wouldn't hurt to do a little liver detox.
Yeah.
Because
that's what I was going to say. Back when I was in my 30s, early 30s, probably. Last year, yes. And I got with some multi-level company, and they had these real liver pills, because I was dragging.
Desiccated liver.
My story is just, I couldn't even stand for more than 5 minutes. I was just dead. But I got on those and started taking those, which liver has high amounts of choline in it. And the energy that returned to me.
Oh, great.
Just by cleaning out the liver. And we have that whole podcast, Eat It or Take It. We tell about that story of the mice that didn't have real liver in their diet. They had fake B vitamins in their diet, and they could last about 2 minutes in the water. But those that had liver they stopped the experiment after they swam.
8 hours or something like that?
No, it wasn't that much. It was like 2.5 hours. They stopped the experiment.
Because they were still swimming. So they're like, real liver works. Yep.
And it could be a lot to do with the choline, that is the high amounts of choline in liver. So eat it or take it, in my opinion.
Significantly elevated levels of ALT, like I was talking about here with my patients a minute ago, alanine transaminase, often suggests the existence of other kinds of medical problems, because that's what they're doing that test for. They're looking for problems that may be related to hepatitis, diabetes, congestive heart failure.
Oh, just those. Can you
liver
go those
damage,
slower?
bile duct problems, mononucleosis, or myopathies of some kinds. So elevated ALT is a way of screening for liver problems. And if you have a high enough level of ALT beyond the normal range, they'll want to do a lot more tests on you. But it also may be caused simply by nothing more than a dietary deficiency of choline.
Yes. So non-alcoholic fatty liver disease is the most common form of liver disease in the United States, with an estimated prevalence of 30 to 40% among the adult population.
That's quite a bit.
Yeah, that's a lot. But considering that 80% of Americans are also likely insulin resistant, the metabolic syndrome here, and an estimated 90% of the U.S. population is deficient in choline.
9 out of 10 people deficient in choline.
Yeah, well, then it's not surprising, the non-alcoholic fatty liver disease.
Yeah. According to Dr. Chris Masterjohn, and we've talked about him before, I think he's in the University of British Columbia, if I remember right.
He has a PhD in nutritional science.
Yeah, he knows what he's talking about. He said choline deficiency actually appears to be a far more significant trigger of non-alcoholic fatty liver disease than excess fructose.
Ooh.
And if you do a search for non-alcoholic fatty liver disease on the internet, you'll see the number one culprit being too much fructose, because fructose takes... sugar, sucrose, table sugar, goes right through the liver into the blood as glucose. Fructose has to go through 3 steps before it is reduced to a form which is a metabolite of the original fructose. Fructose does not get out of the liver into the bloodstream. It goes into the liver through the portal system when we eat food, but it comes out of the liver as a totally different form. And the problem is it backs up the liver if you have a lot of fruit or other sources of fructose in your diet, especially with fruitarians. And so he says this. He said that in his rise, or in his opinion, the rise of non-alcoholic fatty liver disease is largely the result of shunning liver.
As we talked about.
Liver, and egg yolk. And he said this, I quote, More specifically, I currently believe that dietary fat, whether saturated or unsaturated, or anything that the liver likes to turn into fat,
like
fructose and ethanol, will promote the accumulation of fat as long as we don't get enough choline. Now,
so if we don't have enough choline and we eat a ton of fructose,
or we drink a lot of beer, you're going to end up with belly
alcohol,
fat.
Yeah.
Now, I picked beer because of the grain that's involved and the fact that that is a carb. Yes, but my beer is light, ultralight, super powerful atomic energy ultralight. It's still the alcohol in there, if you get more than your liver can handle, and the grain, more than your liver can handle at a time, it's going to be turned into fat.
And then if you eat bad oils on top of it, so finish that last paragraph. Once
the fat accumulates, the critical factor...
This is Dr. Master John again.
The critical factor igniting an inflammatory fire to this fat is the consumption of too much PUFA, polyunsaturated fats from vegetable oils, corn oil, soybean oil, canola oil, all the horrible, overly processed oils that are very damaging to human physiology. So that just adds
flame to the fire.
Yes.
Is what he's saying.
Yep.
So we're just yelling at you today. No alcohol.
Bend over. I'm taking off my belt right now. So one of the more serious side effects of fatty liver disease, of course, is liver carcinoma, cancer of the liver, the cancer of the hepatocytes, as the constant alteration of normal liver function leads to sustained inflammation. And a lot of cancer research today says it's the constant inflammation of a cell. I remember when I was doing my undergrad in pre-med studies, working in a hospital, and I remember this, I can still see the doctor. I think he's probably long gone by now. And we were talking about iodine.
Wow.
And he said, we know that if you take a 1-inch square area on the body and paint it with iodine for an entire month. Now, when we do an iodine skin test that we don't normally recommend because it's terribly unreliable. But if you did it for 30 days
in the same
spot, you will develop a liver cancer, a skin cancer, because of the irritation and the inflammatory effect that has upon the skin. Now, when you constantly have your liver having to deal with these PUFAs, polyunsaturated fatty acids, and some of them are, DHA and EPA, your essential omega-3s are PUFAs. Some of them are very, very vital for life, but most of the PUFAs we get in our life are not.
The vegetable oils.
And so one of the more serious side effects of this kind of an effect is cancer of the liver because of the sustained inflammation.
Yeah.
Right, as well as assortment of all kinds of serious chemical changes in the liver that could also lead to cancer.
Whoa, so the link between choline and fatty liver initially emerged from research into type 1 diabetes. Studies in the 1930s, this way back then, showed that lecithin in egg yolks, which contains high amounts of choline. I cry when people throw away their egg yolks. My brother did the other day. I know. Just cried.
And we can still go to what would be considered a health-oriented restaurant, and they have egg white omelets.
I cried, and
You're out of your mind.
Yeah, we went to breakfast, and I was full, and I gave him my egg, and he ate all the egg whites and left the yolk.
Left the yolk behind.
I was like, you're not going to eat that. Anyway, maybe it was a really horrible one. It was yellow. It wasn't orange, so it wouldn't have. Yeah. So anyway, egg yolks contain a high amount of choline, but these studies in the 1930s, and I'm quoting them, said they could cure fatty liver disease in type 1 diabetic dogs.
Yep.
They later found choline alone provided the same benefit.
Right, they didn't.
So you could take the supplement choline.
Yeah, you didn't have to feed them egg yolks. Just give them the supplement choline. So high.
So that's really critical. But we're going to introduce something here because we're always talking about the benefits of saturated fat and how good it is for you. We've been talking tons about eating high saturated fat, those egg yolks. The highest saturated fat is coconut oil, and we're always talking about doing the MCT oils and the coconut oils and the butter and all this stuff. But here's something you need to know. This is forbidden information. High saturated fat increases your need for choline.
Now that may be the most important thing, Mary, that you say this entire podcast.
Yeah. What it means is that in order for your liver to be able to get rid of the excess fat, it needs choline. And the more dietary fat you consume, the higher your requirements for choline. And this is true for all types of fat. But interestingly, high saturated fat intake increases the need for choline to a greater degree than unhealthy fat intake, such as corn and vegetable oil.
Yeah. Now, you want to say that again because that sounds almost counterintuitive. The more healthy fat you're taking, the more choline you need. And we're going to talk about that.
Yeah, because saturated fat is really strong.
Yeah, and choline, the lecithin, the whole concept of lecithin is to thin that down, is to help the body to emulsify it. Right. Now, that said, the most significant culprit in non-alcoholic fatty liver disease is excessive fructose.
It still is.
As all of it must be metabolized by the liver and primarily converted into body fat opposed to being used for energy like glucose is.
Yeah.
So Master John also said this. In 1949, researchers showed that sucrose and ethanol had equal, now sucrose being table sugar, sucrose and ethanol had equal potential to cause fatty liver and the resulting inflammatory damage that increases in dietary protein, extra methionine, extra choline could all completely protect against this. Increases in dietary protein, especially methionine, an essential amino acid.
Which is an amino acid. It's essential. You have to get it from your diet.
Right.
It's in the liver. Woo. Just had to throw that out there.
Conversely, much more recent research has shown that sucrose is a requirement for the development of fatty liver disease in a methionine and choline deficient model.
Ah, so we're introducing another nutrient, not just choline, but methionine, which is an essential amino acid. It's a breakdown of a protein. It's easier for people to understand that, I think.
Now, for those deep thinkers out there that know a little bit about biochemistry, methionine is a very important methyl donor for methylation to take place. And that helps with the very thing that we're talking about. And this methionine choline deficiency produces not only the accumulation of liver fat, but massive inflammation to the worst forms of fatty liver disease that have been seen in humans. And what no one ever mentions about this diet is that it's primarily composed of sucrose and its fat is composed entirely of corn oil.
This is Dr. Master John talking.
Yes.
We're quoting him.
Yeah, sugar and corn oil, vegetable oil.
Oils.
One of the most immediate sources is pastries.
Yes, or salad dressing.
Or
they have vegetable oil and sugar in it.
Yes.
Who wants to eat a salad dressing without sugar in it? Oh, look on the ingredient list. It's always right up at the top.
Yeah, that's why we want that. That's why because our body is craving the fat, but it's the wrong kind of fat unless it's the right kind of oil.
Then it's fine.
And sugar in there.
Yeah.
And if you get a low-fat salad dressing, the only way you ever eat a low-fat salad dressing is it's half sugar. It's got as much sugar in as a can of pop does.
And tons of spices, and also, which that's not the bad part. But then you eat these vegetables that aren't cooked that you can't break down, and then you come down with non-alcoholic fatty liver syndrome, and you're like, I've been eating salads for 10 years.
Oh, this is not possible. I eat healthy.
Well, maybe if they put an egg, egg yolk, how the Cobb salads, that might help.
Well, the picture is clearly emerging from, this is Dr. Master John. The picture that is clearly emerging from all of these studies is that fat, or anything from which fat is made in the liver, such as fructose and ethanol, is required for the development of fatty liver. But in addition to this, some factor, overwhelmingly, it appears to be a choline deficiency. And it deprives the liver of its ability to export that fat. Now, your liver, anytime you take in more calories than you need, your liver is going to convert it to fat. Now, if you can't get the fat out of the liver, which is one of choline's most important jobs, because again, it helps to mobilize the VLDL to get the fat out of the liver into the bloodstream, where it's needed in the rest of the body for energy.
And wounds, healing wounds.
And provide energy for the cells.
Tears and lesions
because
inside your body.
The cells need those triglycerides because when your blood sugar goes down, the only reason you don't starve to death is because of the fat in the bloodstream, and your cells pull that fat into the bloodstream or into the cells for energy.
So go ahead.
Well, I was just going to say, if you're like most people, you begin hearing what I'm talking about in your 70s or your 80s or your 90s, depending on your age, but eggs, unfortunately, have received a very bad rap for the last 30 years or so, but recently new information and, of course, forbidden science
Hey,
that we bring to you.
It's not 30 years ago. It was just the other couple of weeks ago.
Yeah,
My
with
brother
your brother,
wouldn't
yes.
eat the yolk.
Well, eggs, particularly their yolks, the white is just
It's protein.
Protein. It's just albumin.
And it can, as Dr. McBride says, it can clear out heavy metals if it's raw. If it's raw. That's why Mary's milkshakes are so good for you.
The egg yolk is actually very, very good for you.
So if eggs are fatty, okay, answer this, and full of cholesterol, how could it actually be good for your liver? Particularly if your issue is non-alcoholic fatty liver disease.
Well, the secret is the choline, and it's a type of B vitamin. It's a micronutrient.
Yes, because the body can synthesize this amazing nutrient.
Yeah, the liver can make a little.
Yeah, and animals can't, but we're animals, but we can do this. But we can't make vitamin C, so
but
it's
they
kind of
can.
fair. Yeah. But it isn't easy if you have a compromised liver.
Yes.
So that's why people that have fatty liver disease need an external source of choline, either in the form of a supplement or they need it directly in the form of food.
Yes.
Liver and egg yolks.
And there's some research stating that a diet deficient in choline actually causes fatty liver and liver cell death.
Ooh.
We've been reading through that research.
Yeah, it started in the 70s. And,
Yep. Still goes on. Still going on.
Yeah. So when your doctor tells you to not eat eggs, or at least egg yolks, to minimize the saturated fat and the cholesterol,
cholesterol.
The forbidden information is they don't know is that the eggs are the most important health food available, especially raw.
We have said in many podcasts in the past when we talked about eggs, that commercial that used to be on TV, egg, the perfect food, absolutely. A raw egg has everything in it to sustain life.
But even if it's a hard-boiled egg, which I love, hard-boiled eggs, love that, they can contain anywhere from 113 milligrams to 147 milligrams of choline.
Yes.
So it makes it one of the best choices in the American diet. And luckily, we still serve it for breakfast.
And there's only one thing that has more choline as a Mother Nature food than a hard-boiled egg.
Grass-fed beef liver. It beats it with 430 starring milligrams
That's
of choline.
over 3 times as much.
Yeah. So eat your liver.
And so eggs rank very high on the list of foods that are high in either lecithin, which converts to choline, or choline itself. And note that this is the egg yolk only, not the egg white. And the egg whites only have just a micro trace of this micronutrient. But so simply put, if you don't have enough choline, your liver can't move the fat out of the liver. And instead it begins to collect within your liver, creating fatty liver. Now remember, the liver has a tough membranous shell around it.
So if you get hit in the stomach, it doesn't burst.
Exactly. Same with your kidneys. All your major organs have a tough outer lining.
But not your spleen?
But what
Why
happens
do people always
when
burst their spleens?
Because it has a small support structure.
Aww.
That's why a car accident can tear a spleen loose.
You mean holding it where it is?
Yeah. It doesn't have the support structure
that the
bigger we dissected those things. And they don't have the support structure that major organs do.
But the liver is so critical.
Yeah. And so what happens if you start stuffing these organs with fat when they have a tough shell on the outside? What happens,
chemical changes
happen. Think of it. What happens if you overinflate a football, or you overinflate a soccer ball, or you overinflate a balloon? Of course, a balloon's not a tough fibrinous shell. But the internal organ, the internal tissue, what is known as the parenchyma. The parenchyma of the kidney is what does the kidney work. The parenchyma of the liver is what does the liver work. The parenchyma cells in there get squashed. Blood flows get squashed. Nerves get squashed. And so the liver simply does not work right. You have elevated liver enzymes. You've got liver disease when it just may have been choline missing in your diet.
Wow. So some of the places in food.
What if I don't like liver? Now, I personally, I do.
Love
we can
liver.
go to dinner.
You begged me yesterday to go to
I wanted to go get
liver. And
liver
my palate, it's peeling right now.
You couldn't go out.
It's literally peeling the top of my mouth. It's crazy.
So what would be some healthy choline sources?
How fast you heal. Healthy choline sources, of course, is grass-fed beef liver is the best.
Number one.
Yeah, and then you got egg yolks, as we talked about, but wild-caught salmon.
Wild, not farm. Mm-hmm. In farm salmon, it's altered in its structure.
Mm-hmm. Some vegetables do. Organic cauliflower, organic broccoli, organic asparagus. And also fungus shiitake mushrooms
Yes.
has some choline. And they say organic pastured chicken.
Again, organic pastured,
They
not
say.
those that are fed,
Vegetables.
We were in the farm store the other day, the IFA, getting some fertilizer for the yard. And I love going by, because one of the big things out here in the West, I don't know, maybe back east, is chickens in the backyard.
Yeah.
And I was looking at the chicken foods.
Don't say it.
Vegetarian.
Seriously.
Chickens are not vegetarians.
This is just crazy.
I know, but the chicken food was vegetarian.
We think we're so enlightened.
But I understand, because the chicken feed manufacturers are not going to give you a bag full of bugs and worms and dead animals and everything that chickens eat. The thing that creates such a healthy egg is for that chicken to be out there in the sunlight, running down a bug, eating that bug whole and turning that bug, which is actually a nutritious form of protein and fat, into the yolk of the egg. Fortunately, there's a taste transfer that takes place.
What was my brother saying about bugs? He was saying, because we were down in Las Vegas where he lives.
Yeah, we went down for a wedding.
I lived there for 10 years, and the cockroaches are just, crazy insane. You have to spray
them. Well, they have names. They have papers. They have ID. They have passports. There's so many of them.
They're everywhere. So it's so horrible. And we walked out at nighttime, and usually at my brother's, they scatter because you just can't spray enough to get rid of them.
Yeah.
There's no bugs. And he announced to us, we got to research this baby, but he announced bugs are down 70% worldwide.
Worldwide, yeah.
So what are these chickens going to eat? I hope not cockroaches, but...
Well, you can tell whether a chicken was eating what it should eat. If the yolk is yellow, it's not eating what it should be eating. If it's orange like a harvest sun at sundown, it ate the right foods.
We went to a horrible restaurant. I'm not going to name it. Restaurant last night. Oh, it was so horrible. It was so horrible. We tried to find... They had cut up eggs, hard-boiled eggs on the buffet salad bar thing, which you couldn't even really call it a salad bar. And you can't eat that stuff because it's not organic. But I did get the egg, and it was like so yellow, it was almost white, the yolk.
It was pale. It was like a pastel yellow.
And I was like, is this even safe to eat? Yeah. It was very sad. So.
Well, or what if you don't want to eat liver or yolks or fish or mushrooms, and you don't want to, and you don't like cauliflower, broccoli, or asparagus?
Well, then you supplement. Standard Process has a product called choline. Wow, that's really well named.
And when you look at the ingredients, choline.
That's all that's in there. So take that anytime you have a lot of saturated fat,
It should be taken with fats. Yes.
It should be taken with fats. It will help emulsify them and, of course, as we discussed, get the fat out of your liver. And then there's another product called soybean lecithin.
Which will break down into choline in the digestive process.
Yep, and the all-important protofood that is in almost every protocol we ever do. It has the methionine in it that we've been talking about. It's the essential amino acids. So those three supplements can really turn your life around with, the lowering the risks of heart disease, breast cancer, and fatty liver disease.
Yes. So, and then remember, sucrose and alcohol, sugar and alcohol, has the potential to cause fatty liver disease and severe inflammatory damage, but extra methionine and extra choline completely protects against this effect, according to Dr. Chris Masterjohn.
Yeah, we didn't say that.
He did.
He said that. He took it from a study. It's study number 26. Let's see what that is, the British Medical Journal. So we're not going to read the study.
What's the date? Does it have the date there of that study?
Yeah, no, I can't see it. It's off the screen. No. Oh, yeah, 1949.
Yeah.
Back before 1950.
That's right.
When they stopped studying nutritional food as a therapeutic.
They started studying drugs
and
stopped studying
British Medical
foods.
Journal, 1949, November 5th.
Makes perfect sense.
Ooh, they just barely got it in, November 5th. But they slammed the door shut.
Yes, and there's this laboratory in Brazil that produces a choline and methionine deficient food for laboratory test animals to actually induce liver damage. Now wait. Don't tell PETA this.
Say that again.
There's a laboratory in Brazil that produces a choline and methionine deficient food for laboratory test animals in order to induce liver damage.
So they can study it.
Yeah, because it will cause precancerous tumors and or liver cancer in the test animal.
Wow, that is powerful.
Yeah,
so
because
they pick out choline and methionine, and they get liver cancer.
See, they pick up rats in the sewers and the gutters and the subway areas, and they're healthy.
Yeah, I know, because they're
healthy
everything.
because they're eating crap.
Especially eggs. Animals love eggs.
And they're healthy animals, so they get them, or the animals that they raise, reproduce, all this kind of stuff in cages in laboratories. They're healthy animals. Wow. The only way they can get them sick enough to test them for diseases is to change their diet.
Yeah.
They're not out getting exposed to vaccinated or unvaccinated people. They're not out. What they do is they feed them soft drinks, and they feed them foods high sugar foods that are known to be missing by chemical test micronutrients that sustain health.
Well, that's some of them. Some of them they do inject with toxins. I've read studies.
Well, but in this case, with these test animals, if they're testing it for a cancer induction or a cancer inducement taking place as a result of malnutrition, they cannot be giving them a carcinogen.
You're right. Or it wouldn't be.
That's right. So the foods are checked to make sure they have no carcinogenic aspects, which rules out most of American foods. And they have to have special diets, and that's where this food comes from in Brazil.
So, keep going.
So in the journal Carcinogenesis, and it's about integrative cancer research, and this is October 1984. This is the title of the research. The induction of liver cancer by dietary deficiency of choline and methionine without added carcinogens.
So you were right. And how did they do this in 1984? Oh, that's right. It's in Brazil, not the United States. So they were still studying food.
Male rats, this is from the abstract. Male rats fed a choline methionine deficient diet from 13 to 24 months developed 100% incidence of pre-neoplastic hepatocyte nodules. Pre-neoplastic meaning precancerous, hepatocyte meaning liver cells, a precancerous liver nodules, and a 51% incidence of hepatocellular carcinoma, liver cancer.
Yeah.
Half of them developed liver cancer. They all developed precancerous nodules. Half of them developed liver cancer. How? Were they breathing fumes from the exhaust pipe of a car? No.
Were they smoking?
No smoking. No sunbathing at the local tanning salon. They were fed a diet deficient in choline and methionine.
Okay, so we've sufficiently scared you and sufficiently. This has been way too.
That's our job.
Yes, it's the forbidden job. So let's just recap here. Okay. So
choline, just recap here real quick. Choline, that's found in ample amounts in egg yolks, is an essential nutrient for everything we've talked about: the brain, the nervous system, the heart, the liver, and it's essential for preventing. Now, we didn't say that.
No, Dr.
Because we're not allowed to talk about things that prevent stuff by order of the FDA and the federal and the food and the FTC or whatever it's called. Dr. Masterjohn said this in his studies: is essential for preventing heart disease, breast cancer, and fatty liver disease, including non-alcoholic fatty liver disease.
And coupled with methionine, choline is especially effective.
Yes.
Okay, that's real important because it aids in the process of methylation.
And methylation's kind of a buzzword out there.
I know, it's kind of a fancy.
Yeah, and methylation just means adding a methyl group. You take a lot of different chemical compounds, you stick a methyl group, a CH3 on the end of it, you change its solubility in water, you can change its pH, and the body does an awful lot of methylation processes in every cell of the body. And choline and methionine and choline are important for that.
Okay, and pregnant and nursing mothers, we're recapping here. Pregnant nursing mothers need a large amount of choline. Choline is required for proper neural tube closure, brain development, and healthy vision.
Yes.
Remember, and their memory also.
Yes.
Low choline intake can cause an elevated homocysteine level and can raise the risk for preeclampsia, premature birth, and very low birth weight.
And remember, homocysteine, along with CRP, are two chemical compounds that indicate internal inflammation taking place. Now, here's a number for you.
Not getting
An
enough
estimated 90% of the U.S. population is deficient in choline.
Wow.
A nutrient that's required to move the fat out of the liver that we've talked about. And non-alcoholic fatty liver disease is the most common form of liver disease in the country. And there are states now where cancer is moving ahead of heart disease as the number one killer. And 90% of Americans are choline
Well, it is
deficient.
in children. How much? I mean, this cold cereal they eat for breakfast instead of eggs.
Yeah.
I mean, cancer is the number one killer of children.
And here's another number, 30 to 40% of our adult population is estimated to have non-alcoholic fatty liver disease.
That's a lot.
If your belly is tight, if you're developing belly fat, but not a lot of fat in other places, but definite belly fat, oh, you have low T. Well, maybe you do, but maybe you've got a cold. Yes.
Bad adrenals, we could go on.
Yeah. A weak adrenals, that's right.
Yeah.
But 90% being choline methionine deficient, and that leads to belly fat because of the liver becoming fatty itself. Now, fatty liver disease and belly fat are two different things, but physiologists tell us that a lot of the belly fat comes from the fat that's in the liver that can't be transported to other parts of the body.
We should open a clinic with just choline in it.
Oh, you could.
And protofood.
And protofood. So in the absence
For
of
flat
sufficient...
tummies.
Yeah. In the absence of sufficient... No, try that. Regardless of all the science behind this, suggests that choline could lead to weight loss.
Oh, you'd be...
And watch what the government does.
Oh, you'd be...
Oh, you'd be out of business in no time.
So, in the absence of sufficient choline, even healthy saturated fats can contribute to fatty liver.
Yes.
Choline minimizes liver fat no matter what the source. And the more dietary fat you consume, even if the fat is healthy, the higher your requirement for choline.
Yes.
So eating a diet high in healthy saturated fats may actually increase your choline requirement.
Yeah, absolutely.
So that's why Mary's milkshake comes in again. So when you eat these gobs of coconut oil or your bulletproof coffee with lots of butter in it, take choline with it or eat egg yolks with it.
Yeah.
Which is what a lot of people do for breakfast. Their coffee, their butter coffee, it's bulletproof coffee, and eggs.
Yeah. So simply put, if you don't have enough choline, your liver can't move out the fat. And instead it collects inside the liver, creating a fatty liver.
And then cardiovascular disease, the most important causes of human mortality in the world, cardiovascular disease. It's been shown in an NIH study that higher intakes of choline is associated with lower plasma homocysteine levels, or inflammation, basically, in the heart.
Right.
We've got a study on that.
And we've already said that pregnant and breastfeeding women need extra choline and methionine, just as athletes do, just as postmenopausal women do.
Well, we haven't said that yet.
So do pregnant and breastfeeding women.
Yeah, so remember that. Athletes need more, and postmenopausal women need more.
And in a very important case-controlled study that was conducted by the March of Dimes years ago in Berkeley, California, low dietary intake of choline in pregnant women significantly increased neural tube and oral cleft defects in babies.
So it's spina bifida and the cleft
palate. Yeah.
Ooh, palate. I got a bad palate right now. Sorry.
So if you already have fatty liver disease, you'd be wise to pay attention to getting some more choline in your diet. I guess that's what we're talking about here. A study on the severity of 664 people with non-alcoholic fatty liver disease found that decreased choline intake significantly increased their symptoms, including fibrosis.
The thickening and scarring of connective tissue
Right,
inside your
and
body.
there may be a connection here with that in fibromyalgia that has fibrotic tissue forming between the muscles and in the muscles. So the next time I have a new patient coming to me talking about fibromyalgia, I'm going to put them on choline immediately.
Choline with every meal. And for the best recap of all, if you have severe inflammatory damage inside and you simply are not going to stop eating sugar, stop eating bad vegetable oils, corn, soy, canola, you're not going to stop drinking alcohol, and you refuse to eat egg yolks or beef liver, then know this simple trick. Taking extra choline and methionine, which is an essential amino acid. Remember, our body doesn't make it. You have to get it in your diet. You can effectively, completely be protected against the effects.
Just extra choline and methionine.
Dr. Chris Masterjohn said this.
Yep.
So, for a simple place to start, I would start with choline, 6 a day, or with excess fat, or sugar or alcohol, just pop some choline. We've now put it all over the house.
Yes, for all of our alcohol.
Yeah. Well, we eat a lot of saturated fat, too.
Yeah, there's not, I don't, where would you find sugar? We've got some honey on the counter for
No,
teas.
I was talking about saturated fat.
I know, but I'm saying that you're not going to find any alcohol. Where are you going to find any sugar? There's there's sucrose and honey. I put some honey in my herbal tea.
Yeah.
But we do have a lot of saturated fat.
Yeah. And then I would also, so choline would be one thing I would add. Soybean lecithin, chew up 6 every morning. Just chew them up. Put them by your bed.
I don't chew them. You do, but you say they just have a nutty flavor.
Yeah, they don't taste bad at all. Yeah. Chew them up. And protofood, 1 a day or 3 a day if you're mostly a vegetarian.
Yes.
Okay? Because as we've stated, the body can convert lecithin to choline, but it needs a boost in the form of amino acids. And this is particularly true with a vegetarian who doesn't eat a lot of fat and those that have fatty liver disease.
Yeah.
They eat lots of carbs and lots of vegetables.
Now, don't we have something on our website about this?
Yeah, if you go to our website and you just type in the search bar on the top left under protocols, search for liver disease or fatty liver, you'll find a very comprehensive protocol for a non-alcoholic fatty liver disease.
At forbiddendoctor.com.
Mm-hmm. But you can also... And it's cart ready and everything, but this is for severe fatty liver disease. It's got hepatotrophin, p&gt in it.
Yeah.
It's got a bunch of
different
different
things.
things.
Where the liver begins to be dysfunctional.
Which isn't expensive if you have fatty liver disease.
Absolutely.
I mean, it's so critical to stop this. But if you would just add those 3 things in, choline, 6 a day, soybean lecithin, chew up 6 every morning and forget about it, and protofood, 1 a day. I mean, that's not...
Yeah, if you have animal products in your diet, 1 a day is all you need. If you don't, you're going to need 3.
You're going to need 3 of those, yeah. And remember, if you can't see the products that we've just talked about, the soybean, the choline, the protofood, then on our website, if you go to our website, you type that you can't see them, you're either not signed in or logged in, okay? Or you need to take the symptom survey to become a member of our website. So,
and doing the symptom survey will give you a personalized supplement protocol, saving you money in the long run, and it costs you nothing. It's free.
Yeah. The statements made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product label or packaging or this podcast is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professional.
So thank you for listening to this Forbidden Information and our Forbidden Podcast.
Join us next time for another in-depth discussion of forbidden knowledge.
We'll see you then.
Thank you for listening to the Forbidden Doctor Podcast. If you are curious about long life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from amazon.com by searching the full term Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.